Yes, Mr. Chair. This meeting is being recorded for minute-taking purposes as well as for posting of the recording of the proceedings on the agency's website. This meeting is also being live streamed on the Access Health TV website. Thank you, Mr. Chair.
Great. Okay, I want to remind everybody, please introduce yourself every time you speak so we know who's making the comment. Could we take attendance?
Yes, Mr. Chair. Grant Ritter, Chair.
Yes, present.
Sean King. Mr. King. I see you. I think you were muted.
Yeah, Sean?
Just show your, can you raise your hand? Okay, thank you. That counts. Mark Schaefer. Matthew Brockman. Manish Dutani. Toon Goen.
I'm on.
Thank you. Brandon Riff. And Paul Lombardo. Thank you. We do have a quorum, Mr. Chair.
Okay, thanks. Is there any public comment?
No, we did not receive any public comments, Mr. Chair.
Okay, in that case, could I have a motion to accept the minutes from our last meeting on the 13th of February? Somebody that was there? Thank you, too. Yeah.
Okay.
Second it? Sean?
Second, Sean?
Thank you.
Did you hear me now?
All right. Could we have a roll call vote on that?
Okay, is there any discussion, Mr. Chair?
Oh, I'm sorry. You're absolutely right. Is there any discussion, comments? If not, could we have a roll call vote on that?
Grant Ritter?
Yes, accept.
Okay, thank you. Sean King?
Yes.
Mark Schaefer?
Yes.
Thank you. Matthew Brockman? Toon Goen?
Yes.
Brendan Riff? And Manish Dutani? Thank you.
Okay, thanks. Now I'll turn it over to Kelly, maybe to turn it over to Julie about the silver plan.
Yes, so welcome and good afternoon. I just wanted to take a moment to say thank you to everyone, understanding that this took an incredible amount of work, and would like to thank everybody for their patience as we work through this process. As the slide indicates, we are up to option 8, but that also doesn't count for all the different iterations that we went through while we were on the phone with both issuers trying to come to a happy medium. So with this said, I'm going to hand it over to Julie, who, big shout out to Julie as well. She was actually out of the country and still facilitating our conversation. So thank you very much, Julie, for helping us through this. So with that said, I'll hand it over to Julie and then we'll wrap up the meeting.
Yes.
All right. Well, thank you, Kelly. And I echo your appreciation of all parties involved. As you can see, we are proposing to reduce the medical deductible to $415, increase the MOOP to $2,950, changing the primary care copay to $35 and the specialist copay to $50, as well as adjusting the laboratory services copay from $10 to $15. As you can see from the other box, we are trying to fit all carriers within an 87 to 88% actuarial value range. And the challenge really was, trying to work through all the levers. And we found that by adjusting these 5 levers, we were able to get a compliant plan for all carriers. So, so I present this plan as the current best and only option available for the 87% standard plan.
Understood. Well, thank you for all the effort. I can see you had to really juggle a few things to get this to fall into place. Do I hear a motion to accept this plan from somebody?
Motion. This is 2.
Thank you, too. Seconded?
Seconded. Mark.
Any discussion? Nope, I think we're pretty much talked out. Since no discussion, could we have a roll call vote on this?
Graham Ritter,
Yes.
Sean King,
Yes.
Mark Schaefer,
Yes.
Matthew Brockman, John Goen,
Yes.
Brendan Riff, and Manish Sutani. Thank you.
It's Matt Brockman I got here, sorry, yes.
Okay, yes, okay.
Thank you,
Just
Mr.
in time.
Brockman. Okay.
Okay,
in time.
motion carries. Kelly, do you want to say anything about next steps?
Absolutely. So what's going to happen at this point is we're going to wrap all these up and present them to the Board of Directors on March 6th, assuming that all of these plan options have been accepted. They will be our standardized plans for 2026, with one exception. We are waiting for the IRS to provide their guidance for 2026 with regards to the HSA limits. So unless something radical happens, we don't expect to have to come back to this committee, but if something does, we will have to come back and talk about plan options again. But we'll keep our fingers crossed that that won't happen. And that's it.
And thanks, Kelly. And Grant, this is Susan Rich By. I would just add that we now have our open enrollment report ready for this past open enrollment for plan year 2025. As we've talked about, it was an incredibly successful open enrollment. We had 151,151 people enroll in plans, our highest ever. So we will be sending that open enrollment report, which has loads of data, out to all the committee members. And then if anyone has any questions, they can just let us know.
Great.
Thank you.
Okay, well, thank you everyone for all your work. Could we have a motion to adjourn? This seems to be the last meeting of the season for us, hopefully.
So moved.
Thank you. Name, who is that?
Mark.
Mark, do we have a second?
Second, Sean.
Thank you, Sean. All right, another vote?
Graham Ritter,
Yes.
Sean King,
Yes.
Mark Schaefer,
Yes.
Matthew Brockman,
Yes.
John Goen,
Yes.
Brendan Riff, and Manish Sutani. Thank you.
Thank you, we are adjourned. Thanks, everyone.
Thank you.
Thank you all
Thanks,
very much.
everybody.
Appreciate it.
See you soon.
Bye-bye.
Thank you.
Bye now.
Bye-bye.